Over the past 2 years, the Royal College of Radiologists has, like all other Royal Colleges, undertaken wholesale review of its educational processes. A significant aspect of this review has been concerned with the development of radiology-specific formative assessment in the form of workplace-based assessment. Formative assessment is designed to give both trainee and trainer feedback on an individual's progress utilising their day-to-day work environment.
Yeah, which I entirely agree with. You felt there were some distended loops on a small bowel.
The Royal College has designed and piloted radiologically specific workplace-based assessments. These will identify learning needs and allow trainees to measure their progress against their peer group. They will identify individual learning needs and act as a motivational spur to allow a trainee to improve and progress. The trainer, through these tools, has the opportunity to observe the trainee, to confirm that they have achieved the required standard, and to plan what further development is required.
The picture's useful and you can sometimes see an obvious block.
The new assessments have been mapped onto the new curriculum, and through a piloting process have been shown to meet PMET-B standards. The 5 assessment methods are Mini-IPX, RAD-DOPS, multi-source feedback or MSF, audit assessment and teaching observation. This range of tools allows trainers to address all components of the new clinical radiology curriculum. The Mini-IPX is an image interpretation exercise.
Okay, so this is a CT case that you did on call, isn't it?
Yes.
So,
The assessor observes the trainee interpreting an image study. It can be conducted in a variety of settings across all modalities. As with all workplace-based assessments, performance is measured using a rating scale.
Thin lingual plates.
yes, absolutely.
An anchor statement in relation to the overall clinical judgment of the trainees informs the process and gives a framework for future development needs. Timely feedback should be given after each assessment. RAD-DOPS is the acronym for the Direct Observation of Radiological Procedural Skills.
And swallow. Very good.
As the name suggests, in this form of assessment, the assessor observes the trainee undertaking a clinical practical radiological procedure from within a variety of settings and modalities. Performance is again measured using a rating scale, although the domains are different from a Mini-IPX and reflect the patient-centred nature of this encounter. The assessment should take little more time than the procedure itself and is again concluded by anchor statements that rate the trainee's overall clinical competence. This informs the feedback that should follow the assessment.
From the point of view that you discussed with the patient, the symptoms, how they presented.
Multi-source feedback, or MSF, is used to anonymously assess a trainee's behaviours, leadership, teamworking and communication skills across the domains of good medical practice.
Paul,
The trainee, following discussion with their educational supervisor, nominates their own raters, so feedback comes from the people with whom the doctor works.
Darren, you just have a look at this image for me.
Strengths and areas for development can be identified from the feedback.
Excellent, thanks for your help.
The undertaking of an annual audit is a PMET-B requirement of all trainees. The audit assessment is designed to establish the trainee's competence in completing an audit.
hello.
The opportunity to assess the trainee is twofold. Firstly, the consultant involved in designing and undertaking the project with the trainee can look at the quality of the process in relation to the audit. And at the point of completion, a different assessor can then review the quality of the results of the audit, either by sitting in on a presentation or reviewing a written report. The rating scale rates the overall quality of the audit and informs the discussions on trainee development in this key area.
So that might in part account for his LVH.
Radiologists have an increasing role in the teaching of a wide variety of healthcare groups, from undergraduates and foundation doctors to allied healthcare professionals.
Just sort of sway the probe over
you want to hit that lesion, but
And
you
not
want
that
to
one.
miss
Yeah,
that
okay,
one.
that's
A trainee's teaching skills can be observed in a number of situations and settings, including multidisciplinary meetings and journal or research
Is
clubs.
there any free air here?
The assessment is designed to be flexible, wholly formative and developmental, with the trainee getting instant feedback on his or her strengths and areas for development across a whole range of teaching issues.
We don't tend to do this, that's usually done by the vascular labs.
But it's just borderline.
Radiology workplace-based assessment is designed for use in our day-to-day radiology practices. It should become immersed in everyday professional life and utilises our apprenticeship style of learning. In real terms, it should be considered as an opportunity to capture the professional conversations you already have with trainees,
RAD-DOPS 4.
to give them an opportunity to receive feedback
Okay.
and to inform their professional development.